A pleasant day to each and everyone. I am Otikal Johaina S, BSN1 students from MIHP, and today I'm gonna show you on how to provide a range of motion exercises. Providing range of motion exercises. Definition: range of motion or ROM is the complete extent of movement of which a joint is normally capable. Taking part in a routine activities of daily living helps to use muscle groups that keep many joints in an effective range of motion. When all or some of the normal activities are impossible, attention is given to the joints not being used or to those that have limited use. When the patient does the exercise for him or herself, it is referred to as active range of motion. Exercise performed by the nurse without participation by the patient are referred to as passive range of motion. Exercises should be as active as patient's physical condition permits. Allow the patient to as much as individual activity as his or her condition permits. Range of motion exercises should be initiated as soon as possible because body changes can occur after only 3 days of impaired mobility. Equipment. No special equipment or supplies are necessary to perform ROM exercises. If appropriate, non-sterile gloves and or other PPE should be worn. Assessment. Review the medical record and nursing plan of care for any conditions or orders that will limit mobility. Perform pain assessment before the time for the exercises. If the patient reports pain, administer the prescribed medication in sufficient time to allow for the full effect of the analgesic. Assess the patient's ability to perform ROM exercises. Inspect and palpate joints for redness, tenderness, pain, swelling, or deformities. Nursing diagnosis. Determine the related factors for the nursing diagnosis based on the patient's current status. Appropriate nursing diagnosis may include impaired physical mobility, deficient knowledge, impaired body mobility, acute pain, activity intolerance, chronic pain, fatigue, impaired skin integrity. Outcome identification and planning. The expected outcome to achieve when performing range of motion exercises is that the patient maintains joint mobility. Other outcomes include improving or maintaining muscle strength and preventing muscle atrophy and contractures. First, review the physician's orders and nursing plan of care for patient activity. Identify any movement limitations. Second, perform hand hygiene and put on PPE if indicated. Then identify the patients, explain the procedures. The fourth one, close curtains around bed and close the door to the room if possible. Place the bed at an appropriate, comfortable working height, usually elbow height of the caregivers. Adjust the head of the bed to a flat position or as low as the patients can tolerate. Then stand on the side of the bed where the joints are to be exercised. Lower side rail on that side if in place and cover only the limb to be used during the exercise. Perform the exercises slowly and gently, providing support by holding the areas proximal and distal to the joint. Repeat each exercises to 5 times, moving each joint in a smooth and rhythmic manner. Stop movement if the patient complains of pain or if you meet resistance. While performing the exercises, begin at the head and move down one side of the body at a time. Encourage the patient to do as many of these exercises by him or herself as possible. Move the chain down to rest on the chest. Return the head to a normal upright position. Tilt the head as far as possible toward each shoulder. Move the head from side to side, bringing the chain toward each shoulder. Start with the arm at the patient's side and left the arm forward to above the head. Return the arm to the starting position at the side of the body. With the arm back at the patient's side, move the arm laterally to an upright position above the head, and then return it to the original position. Move the arm across the body as far as possible. Raise the arm at the side until the upper arm is in line with the shoulder. Bring the elbow at a 90-degree angle and move the forearm upward and downward. Then return the arm to the side. Bend the elbow and move the lower arm and hand upward toward the shoulder. Return the lower arm and hand to the original position while straightening the elbow. Rotate the lower arm and hand so the palm is up. Move the hand downward the inner aspect of the forearm. Return the hand to a neutral position even with the forearm. Then move the dorsal portion of the hand backward as far as possible. Bend the fingers to make a fist, and then straighten them out. Spread the fingers apart and return them back together. Touch the thumb to each finger on the hand. Extend the leg and lift it upward. Return the leg to the original position beside the other leg. Left the leg laterally away from the patient's body. Return the leg back toward the other leg and try to extend it beyond the middle line. Turn the foot and leg toward the other leg to rotate it internally. Turn the foot and leg outward away from the other leg to rotate it internally. Bend the leg and bring the heel toward the back of the leg. Return the leg to a straight position. At the ankle, move the foot up and back until the toes are upright. Move the foot with the toes pointing downward. Turn the sole of the foot toward the midline. Turn the sole of the foot outward. Curl the toes downward and then straighten them out. Spread the toes apart and bring them together. Then repeat these exercises on the other side of the body. Encourage the patient to do as many of these exercises by him or herself as possible. When finished, make sure the patient is comfortable with the side rails up and the bed in the lowest position. Then last one, remove gloves and any other PPE if used. Perform hand hygiene.